Hi, I'm Dr. Max Lingenfelter. Welcome to our introductory video outlining my background and training and the conditions we treat. I'm a board-certified fellowship-trained joint replacement surgeon with a background in the most up-to-date, cutting-edge techniques such as robotic and AI-assisted surgery, minimally invasive techniques like small incision robotic knee replacement, as well as direct interior hip approaches. Our skill set includes partial and total knee replacement like uni arthroplasty and patellofemoral joint replacement of the kneecap or patella. We also focus on accelerated protocols or ERAS protocols like same-day surgery to make sure our patients are getting back to doing what they love as soon as possible. I began my career in the field of biomedical engineering at the University of Houston, earning the distinction of cum laude and honors in major, as well as several other awards including the distinction of Chevron and Exxon Scholar. I then obtained my doctorate from the University of North Texas TCOM in Fort Worth, Texas. My general orthopedic training began with a residency at the Rowan University Inspira Health Network campus, where we trained in various facilities from Philadelphia all the way down to Atlantic City. One institution we spent extensive time training with was the Rothman Orthopedic Institute, widely recognized as one of the most advanced joint replacement institutions in the country. I then completed this training with an additional year of fellowship arthroplasty distinction at the University of Minnesota, which is one of the oldest and most well-established academic orthopedic training centers in the country. We focused on the most advanced and up-to-date techniques in the field of joint replacement and also the most complex cases a surgeon could possibly encounter. Our areas of clinical expertise include arthritis or joint pain of the hip and knee, both operative and non-operative management, meniscal injuries requiring joint replacement, labral tears requiring hip replacement, avascular necrosis of the hip, and failed prior hip or knee replacement. Conditions outside our focus would include low back pain or lumbar spine pathology, foot or ankle diagnoses, hand, shoulder, or elbow conditions, or isolated meniscal or labral injury not requiring joint replacement. We have close partners that are subspecialty trained to treat all of those conditions, and we would be happy to see you to initiate the workup and preliminary treatment, then connect you with our care partners for definitive management. When patients ask me why orthopedics, as a biomedical engineer, I had the unique opportunity to work with many different physicians, helping design medical technology. And during one particular experience, I got to observe an orthopedic surgeon in the operating room. And I thought that was the coolest thing I'd ever seen. It was the perfect combination of technology and biology that allowed them to improve patients' quality of life. It was a very profound experience for me. I chose joint replacement to focus on because during my general orthopedic residency, I got to work on the joint replacement floor, helping patients recover from their surgery. And I remember one particular patient that stopped me the morning following her hip replacement and said, "Thank you so much. I just had the first night of sleep in the last 8 years where I wasn't disturbed by the pain. So thank you, thank you, thank you." And I remember seeing her appreciation and dramatic improvement in the quality of life, which was almost immediate. And that convinced me I had to make this the focus of my career. I'm very lucky that I get to focus on the thing I love exclusively, which is hip and knee replacement. This means I get to do between 300 and 400 joint replacements each year. When I'm not focusing on my patients in clinic or in the operating room, I like to spend time with my family, our 3 children, and my wife. We enjoy hiking in the various areas around DC and Northern Virginia. I also like to spend time playing music, hunting, reading science fiction novels, and lifting weights or riding my bike. When I think of the future of arthroplasty and joint replacement, I'm excited most about the drastic improvements that will continue to be made to improve the patient experience. That when someone trusts us to perform their hip or knee replacement, we will continue to make that experience better and better every year. And reducing postoperative pain, shortening the recovery period, that's what excites me the most. This has been our introductory video on meeting myself, Dr. Max Lingenfelter. Thank you for watching. If you would like to see more, please hit the like or thumbs up button and share with your friends or family. Thank you very much. I hope you have a wonderful day.